Good morning all. Welcome to today's video. So in this class we will be discussing regarding the psychiatric disorders in pregnancy. In previous video we already discussed the depressive disorder. So today anxiety disorders. So as we know that anxiety is a feeling of apprehension caused by anticipation of an ill-defined threat or danger that is not realistically based. So the person is having some of the apprehension that maybe she may be anticipating that she will get some of the ill threat or danger from somebody. So that will leads to the anxiety. It is the emotional reaction to a non-well-defined external threat or danger. So that is called anxiety disorder. So the types of anxiety disorders are pain disorder, obsessive compulsive disorder, generalized anxiety disorder and phobic disorders. So the types of anxiety disorders are panic disorder, obsessive compulsive disorder, generalized anxiety disorder and phobic disorders. So the panic disorder, it is an anxiety disorder characterized by recurring severe panic attacks. The course of panic disorder during pregnancy is variable and remains unclear. While case reports of pregnant women with pre-existing panic disorders have suggested a decrease in symptoms during pregnancy, large-scale studies have reported that there is no decrease in symptoms for women with pre-existing panic disorder. Next, we will move on to generalized anxiety disorder. No data on the prevalence or cause of generalized anxiety disorder through pregnancy. Difficult to differentiate from normal anxiety during pregnancy. If already on treatment for generalized anxiety disorder, switching to CBT should be considered. Obsessive compulsive disorder or OCD. It is an anxiety disorder characterized by thoughts that cannot be controlled or obsessions that we cannot control and repetitive behaviors or rituals that cannot be controlled. Compulsions in response to these thoughts. So there will be obsessions there. Related to that there is compulsions will be there. So that compulsions we cannot control. So the symptoms of the disorders include excessive washing or cleaning, repeated checking, extreme hoarding, preoccupation with sexual, violent or religious thoughts, relationship-related obsessions, aversion to particular numbers and nervous rituals such as opening and closing a door a certain number of times before entering or leaving a room. So OCD symptoms are excessive washing or cleaning, repeated checking, extreme hoarding, preoccupation with sexual, violent or religious thoughts, relationship-related obsessions, aversion to particular numbers and nerves rituals such as opening and closing a door a certain number of times before entering or leaving a room. Several reports suggest that women may be at an increased risk for the onset of OCD during pregnancy and the postpartum period. In one study of women with diagnosed OCD, 39% of the participants reported that their OCD began during a pregnancy. Should be treated normally as usual on psychological therapy. Avoid combination of more than one antidepressants. So, several reports suggest that women may be at an increased risk for onset of OCD during pregnancy and the postpartum period. So, in one study of women with diagnosed OCD, 39% of the participants have OCD begins during the pregnancy time and it should be treated normally as like a psychological therapy. Avoid combination of more than one antidepressants. So, sometimes it will cause a teratogenic effect for the fetus. What are the signs and symptoms? Palpitations, tachycardia, restlessness, profuse sweat, irritability, worrying thoughts, diarrhea, frequent or urgent micturition, sweating, flushing or pallor, feeling dizziness, unsteady or fainting, muscle tensions, tremor, fatigue, muscle aches and headaches. So the signs and symptoms are palpitations, tachycardia, restlessness, profuse sweating, irritability, worrying thoughts, diarrhea, frequent or urgent micturition, sweating, flushing or pallor, feeling dizziness, unsteady or fainting, muscle tensions, tremors, fatigue, muscle aches and a headache. So the management of psychotherapies are supportive psychotherapy, then behavioral therapy can be given, cognitive behavioral therapy is more important, psychodynamic that is insight oriented therapies. So in medicine pharmacotherapy that is SSRI, selective serotonin reuptake inhibitors, citalopram that is Celexa and sertraline or Zoloft. So that is regarding the anxiety disorders. Hope you understood. Please subscribe the channel. Next video we will deal with the eating disorders. Thank you.